AccuNeb albuterol sulfate inhalation solution is indicated for the relief of bronchospasm in patients 2 to 12 years of age with asthma, reversible obstructive airway disease. Dosage and administration. The usual starting dose for patients 2 to 12 years of age is 1.25 mg or 0.63 mg of AccuNeb, administered 3 or 4 times daily as needed by nebulization. More frequent administration is not recommended. To administer 1.25 mg or 0.63 mg of albuterol, use the entire contents of 1 unit dose vial. 3 ml of 1.25 mg or 0.63 mg inhalation solution by nebulization. Adjust nebulizer flow rate to deliver AccuNeb over 5 to 50 minutes. The use of AccuNeb can be continued as medically indicated to control recurrent bouts of bronchospasm. During this time, most patients gain optimum benefit from regular use of the inhalation solution. Patients 6 to 12 years of age with more severe asthma, weight greater 40 kg, or patients 11 to 12 years of age may achieve a better initial response with the 1.25 mg dose. AccuNeb has not been studied in the setting of acute attacks of bronchospasm. A 2.5 mg dose of albuterol provided by a high concentration product may be more appropriate for treating acute exacerbations, particularly in children 6 years old and above. If a previously effective dosage regimen fails to provide the usual relief, medical advice shall be sought immediately, as this is often a sign of seriously worsening asthma, which will require reassessment of therapy. The drug compatibility, physical and chemical, clinical efficacy and safety of AccuNeb solution when mixed with other drugs in a nebulizer have not been established. Contraindications. AccuNeb albuterol sulfate inhalation solution is contraindicated in patients with a history of hypersensitivity to any of its components. Warnings. As with other inhaled beta-adrenergic agonists, AccuNeb can produce paradoxical bronchospasm, which may be life-threatening. If paradoxical bronchospasm occurs, AccuNeb shall be discontinued immediately and alternative therapy instituted. It shall be noted that paradoxical bronchospasm, when associated with inhaled formulations, frequently occurs with the first use of a new canister or vial. Use of anti-inflammatory agents. The use of beta-adrenergic bronchodilators alone may not be adequate to control asthma in many patients. Early consideration shall be given to aiding anti-inflammatory agents. Corticosteroids. Information for patients. The action of AccuNeb albuterol sulfate inhalation solution may last up to 6 hours, and therefore it should not be used more frequently than recommended. Do not increase the dose or frequency of medication without consulting your physician. If you find the treatment with AccuNeb becomes less effective for symptomatic relief, your symptoms become worse, and/or you need to use the product more frequently than usual, you should seek medical attention immediately. All asthma medication should only be used under the supervision and direction of a physician. Common effects with medications such as AccuNeb include palpitation, chest pain, rapid heart rate, tremor or nervousness. Side effects: asthma exacerbation, otitis media, allergic reaction, gastroenteritis, cold symptoms, flu syndrome, lymphadenopathy, skin appendage infection, urticaria, migraine, chest pain, bronchitis, nausea,